Good evening and welcome to Perspective. The government is to table a bill next week on the premarital screening of couples to check the spread of communicable diseases. This is a welcome move. The Family Laws Amendment Bill is to be presented in the Senate to control spread of HIV, thalassemia, hepatitis, these diseases. Of course, this is a move worth applauding. Today, we'll be talking about its implications and what kind of a positive impact we can expect and whether this will really change things for the better. I have with me Dr. Bina Akram. She's an activist for the cause. Thank you so much for being with us today.
Thanks for having me.
Dr. Nadeem Akram. He's a rheumatologist with and he's with the Punjab Thalassemia Prevention Program. Thank you, Ji, for coming today.
Nice.
And Kamran Murtaza Saab. He's a senior lawyer and former head of the Supreme Court Bar Association. Thank you so much for being with us today. I want to start with you, Dr. Bina. How do you see this as having a positive impact on society, on people suffering from these diseases and the future for us?
Actually, I will take it as the prevention for the child, because any child born with disability obviously is a huge psychological burden for parents when they have to take care of that. And being associated with Thalassemia Center, which I am very happy that we ourselves built in Aptabad way back when I was a student. And at that time, obviously, we were not talking about the legislation for screening or something. We were just providing the treatment. But we were thinking that we should be doing something because it's so common. Sometimes we were so overburdened with that, and treatment itself is expensive and a lot more hazardous. Because when you are giving the blood, then obviously iron deposits and other things.
And we'll
so
talk more about
I see it as a very good move for the protection of the children, so we can have healthy families, and also we can cut the health expenditures, because obviously
of course, that's a huge issue. Yes.
Huge issue.
Dr. Nadeem, this is really about prevention rather than cure when we talk about screening, right? And obviously everybody is applauding the move, but do you really think that it's going to have a positive impact on our society?
The point is that no doubt it will have a positive impact, and the diseases they mentioned, the point is that one is the inherited and the other one are the acquired. Thalassemia is the inherited one, and the HIV or hepatitis, they are the acquired one. So I think the legislation must be crisp, must be more precise, that it will be maybe, for example, in the countries where they controlled, they eliminated the thalassemia or other inherited disorder, that is through the legislation.
Right.
For example, even in the Saudi Arab and even in the Iran, this is they are the Islamic countries, but there is legislation there. They have to get the certificate before the marriage, first Qablul Azwaj, that the spouses, they are not suffering from thalassemia minor.
Right, so it's already there.
Yes.
So it's already there.
It's in Iran, in Saudi Arabia, in other countries, in Malaysia, and I know that in Malaysia, the Islamic ulamas along with the doctors, they have made the law, and it is not even un-Islamic in a way that if, for example, if there is no legislation and they got married and both parents, they have the thalassemia, then the thalassemia minor, then the point is that if they are the carrier, then in every pregnancy, there are 50% chances to have thalassemia minor, 25% chances to have thalassemia major, and 25% of being a normal.
Right.
So this, and then the point is that the ulamas, for example, in Pakistan, even the AFIP, they got the fatwa from Mufti Shafi that if the pregnancy is up to 120 days, you can and the child is suffering from beta thalassemia major or any disease like that, you can terminate the pregnancy. It is not un-Islamic.
Right.
Pakistan Islamic Medical Association, I am active there. They have also even the fatwa from the ulamas that the pregnancy of 120 days, and that I also mentioned that I am actively working in the Pindi Medical College in Punjab Thalassemia Prevention Program, and the government of Punjab is giving this facility free.
Right, so the screening is free.
Screening as well as the premarital diagnosis.
Right. Kamran Saab, I'll just come back to you. Kamran Saab, you as a lawyer, do you feel that, and Dr. Nadeem has just mentioned that, you know, the Islamic Council is active in this. It's noteworthy that still we need to get the input from other quarters, like the religious. We need input from the religious council also with regard to this bill. So how do you see that? Do you think there'll be any hitches or there can be issues?
Still, bill is to be tabled. It has not yet been tabled.
Right.
I don't know whether it is a private member bill or it is officially being.
It's a
private member bill.
Yes.
Then it has to be examined by the from religious angle also. So unless it is stable, it is before us. The text is before us. We can't say about it. It is.
But what do you feel that you think?
There is no harm in it. There is no harm.
There is no harm in it. And do you think that how will the society react generally towards it? Like Nadeem Saab is saying, it's already in Iran, it's already in Saudi Arabia, it's already present in other areas.
In fact, we have to change mindset of our society. There are certain problems. There are certain problems on the religious side. So the main responsibilities of media.
Right.
They have to change the mindset of the society.
Well, I'll say we're working towards that. Dr. Bina, since you've worked with thalassemia patients, right, and thalassemia patients particularly, how do you think people will react to being screened?
This is what I was trying to second, Dr. Saab, that there, and Kamran Saab as well, that we need to change the mindset as well. Even at that time, when we were providing the treatment, talking in a very, politest way, if we talk about that you shouldn't, we advise the couple that you shouldn't have any more children. At that time, this was the only counseling which was available, and they would be probably thinking not to bring their child to us. So social behavioral change is one important thing. And in my MS-PH, which I recently completed, telling you honestly, I was all the time focusing on finding the indigenous problems and indigenous solutions, because Pakistan society is different. Like we said, it's already in Iran, it's already in Muslim countries where we have to...
But society, just to ask you a follow-up, society in Saudi Arabia is surely... should be, I mean, it's also an Islamic,
more conservative,
more conservative.
You want to say?
So why have we, there has been no positive reaction
Saudi Arabia is a little different than us, because we go by our tribal norms most of the time, right? And over there, one stroke, and if you allow something or disallow, right, that is the thing. And I presented a model which I think for Pakistan society, and it raised the huge debate in my class as well, that for any single issue, there are 4 factors in Pakistan which we need to take into account. One is self, any person, for anything, be it the marital law, be it the couple's decision to get the screening or the family, it's self, then is the society, then is scholar, and then is the state, parliament. So when you take all these 4 on board, and media can provide a huge platform for that, where we can discuss. Right. People should know their options. Society is affected by our notions, scholarly notions, and then certainly by the jurisprudence.
But of course, this is a very real issue. And Nadeem Saab, is it true that around 80,000 babies are born with thalassemia every year?
No. The figure is around about 10,000. Right. And at this time, we may have more than 50,000 patients. Right. Then that is the real figure, and
but
the
right now you're saying we have
carrier
about
rate
50,000.
is just about in society depending
around
upon
the world.
areas.
I think maybe around the world.
The carrier rate in our setup is around about 5 to 6%. But
right,
if there is in a family where there is a family, there is a patient of thalassemia major, the carrier rate is more than 30%.
Just to understand it from a layman's point of view, if both the parents suffer from thalassemia, it is more than what kind of chances does the child have of suffering?
That's what I just mentioned, that if both the parents, they are having thalassemia minor, not major. First of all, we have to understand the major is the disability, the transfusion dependent. Minor is just like normal, but is having one for every function, for everything there are 2 genes. If both genes are abnormal patient, if one gene is abnormal, carrier. So if both the mother and the father both are carriers, then in every pregnancy there are 25% chances to have beta thalassemia major,
right,
both abnormal gene. Rest of the time maybe minor or normal patient. So that is the my point.
Right.
And I just mentioned that for that I think the carrier screening is a very logical step.
Right.
If they have made some step or if they are moving, and as I remember that in the previous assembly, even an MNA from MQM, she was very active about this bill. But what happened that bill we didn't remember at this
well,
time.
inshallah,
So
we'll see this
inshallah,
coming
hopefully
out.
this will not happen with this bill.
Definitely, inshallah, and I think it will be tabled in a few days. But like earlier, we talked about the religious quota in the society, and you know the family laws also fall under the jurisdiction of Religious Affairs Ministry. So, Kamran Sahab, obviously we will be taking input from them also. But since it's a government it's a bill tabled by the government, from the government's member from the government side, we don't foresee any hitches from that quota.
No, there are two way of introducing a bill. One officially, and the second is he may be a governmental MNA, but still he can move bill privately. I think he is moving this bill privately,
right.
And then such like bills are to be, I think, are to be referred to the Islamic Ideology Council also to have their opinion also.
But also the religious ministry.
Religious ministry, but the constitutional requirement is that such type of bills are to be referred to the Islamic Ideology Council, not any opinion from the religious ministry, but
right.
Islamic Ideology Council.
Right, and
their opinion may be relevant.
Right.
May be relevant.
And how do you foresee?
It is not binding upon the parliament, but still the opinion may be relevant, and I think it can motivate to the public also. If a positive opinion comes from the Islamic Ideology Council, it may motivate the society also.
Right. Dr. Bina, is it true that thalassemia can be eradicated completely if the screening is made compulsory over some period of time, according to the Public Health Research wing, I think?
Yes. We can minimize the risks, but we cannot say that up to certain amount of years or whatever time, just getting the screening done, we can eliminate, and after that we should not. Probably you are saying that what I can perceive, that maybe we would not need the screening.
No,
sort of thing.
Screening of course is a good safety mechanism.
But after 10 years, 20 years, something like that,
right.
when it is totally eradicated, no, there are mutations as well. So we cannot say that it can totally eradicate, but slowly and gradually we can, depending on our efforts, right from legislation to the social behavioral changes. It would depend that how we can control that, how much we can control that rather.
Right, right. So it's a relative.
Exactly. It would depend on our efforts.
Right. Dr. Nadeem, it's not just related to thalassemia. I mean, the bill there are other diseases like HIV, and there is, along with that, there is hepatitis and all of these communicable diseases. Can you tell us a little more about this, particularly with regard to the bill?
The point is that Kamran sir will more elaborate, and I think this is the weakness in this bill. I think it's my first hand impression is that they have spread it a lot. It made it specific for thalassemia, fine enough. That's what I mentioned in the outset, right. That thalassemia is an inherited problem. Rest of the diseases, they are the acquired. And then the next question is that, for example, hepatitis, there no effective medicine is being available. Their test may remain positive, patient may not have the disease. So I think this bill may need some, still before giving to the Islamic Ideology Council, the Chaudhry Tanveer Sahab must have to make it more digestible in a way, and more precise, more crisp, that it will open a Pandora box.
It would have been better for it to be narrow and specific.
Yes,
to.
I think that's my humble opinion. May I be wrong, right. But my humble opinion is that it may be more specific,
right.
Because in this manner, this bill, I think it will make a long debate, and at the end maybe not get a positive. If make it more with inherited problems, then I think they might get more public sympathies or more appreciation from the legislation, or the all other aspect.
But other diseases like HIV particularly,
yes.
and AIDS are particularly relevant to this sort of legislation.
My question is that HIV, how much common in our setup? There are specific
Right.
groups.
Right.
Not as much common that every person, there is a, I know that there is some specific group they need to screen. Fine enough if they have this
No,
type
but
of
isn't it
legislation.
true that HIV is on the rise,
No,
particularly
no
in
doubt, no
Pakistan?
doubt. But my point is that it will make legislation difficult.
Right.
Ideally, we must have to screen for
Right.
B, C, HIV, all is being there.
Right.
But it makes this legislation difficult. It is a handicap,
Yes.
in my opinion, handicap in this bill.
People will not go for HIV
Yes.
tests.
It is a handicap in this bill.
But-
I'll not take my data for this test.
But
This
Kamran-
is our mindset.
But Kamran
That
sahab,
is truly, I think, the appropriate way, because Millennium Development Goal was something people already know about.
Right.
This expired in September 2015, and every country selected. It was an initiative by United Nations, and every country picked up the goals according to their own indicators.
Right.
And one of the things, astonishingly, when I was going through that, was that HIV remained stable. As it is a taboo thing, maybe people don't come for even the sufferer. You are talking about a girl who is going to get married. You are talking about a boy, and you want parents or themselves to submit for that test.
But-
and even the patients who are taking the medicine, they do not declare. We have been visiting the
Right.
hospitals, and in some of the top hospitals, they have in their SOPs, standard procedure,
Right.
that they are not able
To
to
be disclosed.
mention this. Though hepatitis, they do mention at the back of the bed.
But confidentiality of a disease, whether it's
Sometimes
hepatitis,
confidentiality has to be broken for the betterment of other people. For example, a nurse who is giving that person the injection, because that is transmitted via the prick, like the
Right,
blood-to-blood contact.
And just I want to add that the
I have to go to
transmission of
doc-
disease from mother to child,
Right.
vertical transmission. My question is that how much vertical
Horizontal.
transmission is possible there in HIV, in HBsA, hepatitis B or HCV?
Right.
I don't, but it is very minimal. Vertical transmission of these diseases, not talking about thalassemia. Vertical transmission from mother to child of B, C or HIV. What is the scientific evidence? That is one important question.
Right. But what's the scientific evidence you tell?
There is, I think, no, weak. C less likely to be transmitted from the mother to the child. Same hold true for the.
Right, but when two people are getting married, of course, it's the mother or the boy or the girl is susceptible if one of them suffers. That's also a fact.
So the point is, someone having HBs, hepatitis C or B positive, you will not going to get married.
No, but it's about knowing what you're going. You have to be aware what the other person,
Yes,
what disease the other person.
Okay,
That's why
that's
we're
fine.
having screening.
That's fine.
But
I think they should-
Kamran sahab,
so-
I'll just come back to you. Kamran sahab, right? We as a society, we anticipate this to be a problematic. And you said that, like you mentioned, that you wouldn't like someone who's as educated.
I'll give an example. Once I was taken to give blood to somebody. I was asked to to give HIV test. Why? Why I should?
But I'm asking technically, as a lawyer.
Technically it is good.
When you have,
Technically it is good, but we are living in Pakistan.
But my question is, technically, when the validity of the marriage, of the union will depend on a certificate, which is what the bill says, that there will be a certificate which will declare that the two people have been screened and the tests are negative, and then the marriage will be valid. For that, if that legislation comes through and it's passed, how will the society react then? I mean, they will have no choice. That's what I'm trying to say.
Technically, marriage will not be invalid. You may ask, you may legislate that some restriction on pregnancy of the woman in such like cases. But technically, you cannot ask that marriage may not be solemnized.
Well, I think that's what the legislation is aiming for, that there will be a certificate that will be provided before the marriage is valid in the eyes of law. I think that's what we're moving towards.
Kindly appreciate that.
But if we suppose, for example, but just for the purposes of discussion, if we suppose that will happen and it will sail through and the bill will become law, how do you see the society reacting then? Because then it will be a law.
You
And
have
it may
seen
not-
the reaction even in
reaction,
Kamran's
the
substance.
reaction,
Yes, I have.
reaction maybe it may not be enforceable. I think.
Right. You don't think it will be
you
enforceable.
can't stop. You can't stop.
Right. So what do you think as a doctor, Dr. Bina? How do we go about preventing a spread of these diseases? If I mean, like already said, the bill, this is very much law in other parts of the world, and yet we as a society are resistant
A
to it.
very interesting and a very valid question. You have seen Kamran Sab's reaction, right? Right here, we are sitting the people who are supposedly have higher degrees, and we do not challenge usually the minimal things, right? But unless you train the society, but as Dr. Sab was saying, there are diseases vertically transmitted and there are horizontal, and they have totally different approach for the treatment and different approach for prevention. So HIV's treatment is different, HIV's spread is different, and HIV as far as it is transmitted to the kid, that has a different thing. So I think public health awareness itself is a very important thing, that public health people should be given appropriate place even with the legislators, because I don't know who have worked on this initially.
Right,
If they have taken aboard public health people, then they would have been better off with that deal.
But isn't it true, Nadeem Saab, that there is no regulatory body for public health education like this PMDC, for example?
Currently,
Is that true? And also, you know, different institutions follow different guidelines.
Maybe right.
Right. So it would.
Yes, you're right in a way
Like
that
Dr. Bina
that's
said.
why these bills are being there, and
Right.
still we
In this
all we
form.
for example
Right.
with 3-4 people, we are not even clear we self about these type of issues, that there is
Right.
no clear cut legislation is very much required according to the constitution in the assemblies or the medical forum.
Right.
Legislation is the time of the need of the time.
Right.
There's no doubt in it. No
Right.
doubt in it.
Perhaps once it's tabled, we'll have more. We'll have a better idea of how it's going to move forward. But
But it may be practicable. It may be enforceable.
right, it may be enforceable, and we hope so. But like you're saying, I mean, it's very interesting. This just analogy comes to my mind that when we go for visa, for example, and if we're applying for visa abroad, we are expected to get tests done for certain diseases, and we very happily go and we get those tests done. If I don't know, I'm not certain at present whether HIV is part of the diseases that we do get tested for, but if it was and it is, then we would gladly go and get it tested and we would submit the forms. So why is it so different for when before a marriage? I mean, it's just procedural, surely.
It's totally different. When somebody is going abroad, maybe it's they are immigrating from Pakistan, or they are going there for a job, or they are going there for vacation.
Or if
And
you're
what
studying.
strata of society that would be, you can very well imagine, right?
Right.
And those who are going for the job, it's their necessity. Probably they'll submit. Those who are going for vacations, they want the time out and they can afford that, they will. And those who are immigrating, again, it's their necessity, they will do that.
Right.
We are talking about the society. We are
Right.
talking about the tribal society which has very firm notions that whatever they have from their forefathers should not be taken away from that,
Questioned,
right? So it is a very personal issue, obviously, giving the test before marriage, right? Your daughter, your son, and wow, what if it comes positive? What people will be thinking? Rather, it would be before going with the proposal,
Right.
because if everything is done and the last moment you are coming up with a positive
you foresee
test.
a lot of technical issues.
Technical
with it.
issues, exactly.
Right. Dr. Nadeem Saab, what's
Treatment.
low antiretroviral therapy coverage?
As I know that in thalassemia, the ideal treatment, that is the number one, the prevention.
Prevention.
Right.
And number two, for rest of the life, they are remain transfusion dependent.
Transfusion.
And because of the transfusion, there is accumulation of iron in the body. So they will need the iron chelation therapy.
Right.
That's what I know.
Iron overstores, they are to be
That is-
taken
for that
from
they
the
will
body,
need
yeah.
the parental or oral iron chelation therapy.
Right. Right.
This would be in relation to HIV.
And that is
yeah,
related
that is
to HIV,
relation
yes.
to HIV,
Okay.
that therapy.
Retrovirus, because HIV is a
This is the
retrovirus.
reason we are
RNA
saying that
virus.
take the doctors
the-
on board,
right.
and exactly, so the technical issues are solved right there,
Right.
that how we can better table that that it is acceptable to the society,
Right.
professionally too.
So it needs to be, we need more
Reviewed
medical
probably.
input
Exactly.
with regard to the bill in particular. But legally, Kamran sahab, we have seen that there are HIV is obviously a disease that has its own taboos, like we talked about, and although the data that is provided, a lot more people are actually suffering from the disease than are registered.
Yeah.
So what do you think are the causes in our society for so much resistance to such kind of legislation and so much conservatism to it?
Controlism and in fact, if the government want to introduce such bill, it can be introduced in peace bill. At the first instance, it can be introduced in some cities.
Right.
Then after seeing the results, then it can be extended. Its scope can be extended to the whole of the country.
Then
Right.
people will immigrate to another city to solemnize them. The way they do for CNG.
Or
They do
it
for
may be made
CNG,
a
right?
provincial subject. Then you may start it from Punjab, you may start it from KPK.
Right. As health is already decentralized in
I think
yeah.
it is after 18th amendment,
Yes,
it is provincial
it
subject.
is now largely a provincial
A
subject.
provincial subject.
But
then,
again-
then it may, I think
Exactly.
it may more feasible
Provinces may
if it
select
is
some
used in
of the
Punjab.
districts, but again the
Right.
thing is that for CNG people go to Haripur. Those who are near to Haripur, I was in Taxila for certain research, and
We'll just come
we
back
discussed-
after a short break when we'll be talking more about the law that is expected to be tabled. HIV. Welcome back, and we were talking about the Family Laws Amendment Bill and its passage. It's to be presented in the Senate to control the spread of HIV, AIDS, thalassemia, hepatitis, and all such diseases. Dr. Bina, as we were talking about society's likely impediments that the bill may likely face, and one of which is the reaction that we as a society might have. How do you, of course, the societies are different, Western societies are more developed, their reaction is of course different, but how do you think that it could have been tackled with? By having a different, by separation of diseases? How do you see it as a doctor? How could these diseases have been separated?
As Dr. Sab mentioned earlier, there are diseases, and I talked a little about that too, that there are diseases where they are transmitted from mother and father. They are genetically transmitted. They are vertical diseases, and some of the sexually transmitted diseases, which is a very tabooed topic, like even saying this, I am stuttering, you can feel, because I can see if someone is trying to put me into certain frame, like, wow, she's so bold that she's talking about that, but realities are there. The thing is, we have to first realize that the things are there. We cannot sweep them under the carpet. And so sexually transmitted diseases, they totally have to be tackled differently. So it would have been better if we could have done it in different pieces, this legislation, one which is genetically transmitted and the other. And I think for sexually transmitted diseases, for me, the best thing is counseling of the couple before the marriage, because we can deal with this thalassemia by doing the blood tests, but other things which the risky behaviors we call in public health, which end up in getting certain diseases, that needs to be counseled, and I think both male and female they should be. But our society probably is going to react to counseling as well, because if you say that you are going to take your going to be bride daughter to a counselor, then how many people would be accepting that? In-laws would be saying that there is something wrong with that. So I think counsels.
This is like counseling with regard to such diseases is another matter entirely. Even psychiatric help in our society is associated with certain taboos. Dr. Nadeem, isn't that true that nobody would disclose that their relatives or somebody you're intending to marry, etc., if they're seeking psychiatric help or any other sort of help also? So there are taboos associated with that also.
That you're right, that the point is that we will not like to disclose that someone is suffering from any ailment that is being there.
Right.
So the mindset it's all required. Then the point is that other than as we all say that the prevention is better than cure. So
right.
I think the message should be clear that we can prevent these disorders, and most of these they can, for example, the psychiatric problem.
Right.
We take person as mad person, but it's not a correct term.
Right.
Most of the psychiatric diseases they can be treated, they can be cured.
Right.
Even without the medicine, just having psychotherapy. So the taboos or they are more strong, the perception is more strong than the reality.
The reality. So how do we go about changing the perception then? Kamran Sahab, law has over time taken into account particular issues in the society, particular taboos also, particular reservations also. How do you, in your opinion, how do you think we can bypass, and by making it mandatory, which is what the bill does?
I think before introducing the law, we have to work over the society. We have to change their mindset. Unless the mindset has been changed, the law will be violated. And if the law will be violated, then it may not be good.
But that's a wider issue. Educating people about laws, that's a wider issue.
But
and
this is part and parcel of that, am I
right? But it's also related to other things. For example, if like we were talking about, before we went on air, that if you see somebody bleeding on the street and a lot of people would just leave. They wouldn't help the person. So that is with regard to
that is not taboo.
Variety
the people don't mind it, no. But
right, but they would still need to be educated about giving help, educated about certain issues, even taboos. So isn't that's a very long-term goal?
Yes, it is long term, and still we have to educate our people.
As there are no shortcuts.
There are no shortcuts.
No doubt
Achievable, exactly.
Right. But so you think that in absence of that kind of an education or that kind of sensitizing the society, such legislation will not have the kind of effects that
Yes. You may have some results in urban areas, but not in whole of the country.
Right, and that's major population.
That is the major problem. Yeah.
Dr. Bina, with regard to diseases like HIV, for example, is it true that a global fund of $16 million was recently given for fighting AIDS to Pakistan?
There are foundations international which fund both for TB and AIDS and other preventable diseases and communicable diseases.
Right.
And the thing is, if we have the right priority, if we tailor it according to our society, only then we can benefit from that. And pardon me if I'm taking more time, but
no, please.
Certainly I would like to add that Pakistan has one of the best health systems, not that it is delivering health system as a structure, I mean, because it starts from the very base and it reaches to tertiary care. But unfortunately, we have not trained our very basic things in a proper way. Like we have the BHU, we have the RHC, we have Tahsil Headquarter Hospital, and then teaching hospitals. People from basic health unit, if they are not available, because retaining the doctor over there is a major problem. Right. Because 5 years they study, and then if they are stuck there without any incentive, like for their further education, whatever. So that is another challenging thing which we should overcome. And we have the health houses. Why we are not training those lady health workers or other staff that they can work with the community? And interesting thing is, which would be very new for you, the 10 of the described things for the officer in basic health unit, only 2 are for the curative.
Right.
8 are for the
prevention.
preventive side, and this includes the community visits as well. But when was the last time we reviewed that we have the right type of things we talk to society? Society have changed a lot because of the media, because of the globalization, more travel, more disasters. Other day I was reading an article that already we know that flour is the same, potato is the same, but now the tastes are becoming the same. Our curries people are trying outside, they're making in their homes, and we are eating the things. So many things we have internationally exchanged.
Right.
But when was the last time we reviewed our policies that from the very basic grassroots level, we will be training the personnel to talk to the community on these subjects? This is urgently
That's
needed.
something, Kamran Sahab, I want to ask you also, as a doctor, you must have encountered numerous issues in our whole care and primary, tertiary care. We don't see a lot of schooling, we don't see a lot of counseling, even when you're going through, not only through diseases like HIV, AIDS, even diseases like, for example, cancer. Unfortunately, the family is going through something, the patients are going through, is going to go through, even the care, chemo for example, involves a lot of support, involves a lot of issues, but we don't see a lot of counseling. Why is that?
The point is that, for example, I think we are not in a way well acclimatized that, for example, there are so many days. For example, there is a World Thalassemia Day. For that specific day, we will have some idea about the thalassemia, but rest of 364 days we will not have any thing about the thalassemia. So all these things are required, that continuously the point that the health, the government and all those, they should allocate the budget or the fund, or they should have the more awareness for the people than the legislation. All these will, inshallah, they will help
What can
and make a
doctors,
healthy society.
as you're a doctor yourself and Dr. Bina is, as a doctor, what do you think that there is a lot of responsibility on your shoulders, on as professionals, as educated professionals also. So in your own profession, do you see a lot of counseling happening? Do you see the doctors
The point is
extending
there, the
themselves?
doctor is being there and think the doctors are giving the information, giving the treatment, giving the cure, all these what they have their own in their own capacity. That's no doubt in it that for example, if someone come to with me and I have an idea, a suspicion that may be suffering from thalassemia is minor, I will definitely tell the person to get the electrophoresis done or other related tests. But the point is that you are in a way right, in a way that even, for example, most of the time even the doctor, they will not have a complete idea about these disorders. So even at the medical side, still it is required to have more knowledge and more acquaintance about these disorders.
Now they
Does
have
that mean
introduced the
that-
CMEs, right?
CME, that is why they
Continued
introduced the
medical
CME.
education.
Right.
Now PMDC have introduced that doctors have to have
Continued medical
education, and only then the license would be renewed. But you are right in asking the question that how we can be dealing with this thing. We can advise the patient when he or she comes to us, but how to better deal with that part of counseling, that is only possible when doctors have more time, or specific people have, like public health people, they have the appropriate places in the society. See, for example, I was discussing with you.
Like we don't have that division of
even for-
GP and we
Exactly.
don't have that division here.
Exactly.
In our medical
And the other
profession.
thing is that counselor people would say that, okay, they don't have any knowledge and it is just about talking and talking. It's not. They are properly trained people, but they don't. They are not accepted by the society, and even not not accepted by government, because if they have the places in hospital, then they can. Doctors themselves are so overburdened. I remember my days living on the floor, because I did my MBBS, MD, and then MSPH, and I remember that living on the floor. On your toes for 70 hours, it is not easy.
Right, it's not
and
easy.
I tried to do my best, but then you need the time to unwind, and you
and that's
get
very
that.
important.
Exactly.
Also, thank you so much for joining me. Unfortunately, that's all the time that we have today. Kamran Saab, Nadeem Saab, Dr. Bina, thank you so much for your time. Yes, this is a welcome piece of legislation. Yes, it is a move to applaudable by the government, but a lot of things need to be taken in account, particularly the fact that we need to sensitize our society to be more open to testing, to be more open to screening. At the same time, the medical professionals also need to be more responsible in their role as advisors, as counselors. Thank you so much for joining me today on Perspective.